Alrighty, I am starting my week 3 patient encounter. This is my blank sheet of paper.
Hello.
Ms. Adams?
Yeah.
Hey, my name is Glenn Adams. I'm a physician assistant student here to take care of you today. This is me washing my hands. How are you?
Good. How are you doing?
Good. Is it okay if I take a minute to write some stuff down so I can chart everything correctly?
Yeah.
Alrighty, Miss Adams. So what brings you in today?
I have a rash.
A rash?
Yeah.
Alrighty. And when did you first notice this rash?
About a week ago.
Okay. And do you know what day that would be?
Friday.
Okay. And can you show me exactly where this rash is?
Right here.
Okay, the middle, like between your two clavicles?
Yes.
And since you noticed the rash about a week ago, it's been there constantly?
Yeah.
Okay. And can you describe the rash to me?
It's got like a profound circle that's a little bit raised.
Okay.
The whole rash is just this like small circle right here, but this outer part outlining the circle is raised slightly.
Okay. Have you noticed any associated symptoms with the rash?
I have not.
Does anything make it feel better?
No.
Does anything make it feel worse?
If I itch it.
Have you been treating it at home at all?
Yeah, I've been putting apple cider vinegar on it with a cotton ball like twice a day.
Okay. And have you noticed the difference with that?
Yeah, it seems to be subsiding a little bit.
Okay. Does the rash radiate at all?
No.
Does it move out? No. Okay. Have you noticed any patterns with the rash?
Nope.
Is it causing you pain?
It's not.
No. And have you had any previous episodes with this rash?
Not that I can remember.
Alright. Alright, now I'm going to ask you some yes or no questions in terms of your rash. Have you noticed any fever?
No.
What about chills?
No.
Have you been fatigued?
Nope.
Do you have a general feeling of discomfort?
No.
Have you experienced any generalized weakness?
No.
What about appetite or weight changes?
No.
Okay. Alrighty. And I know that you said in terms of the rash there's an abnormal texture, it's kind of raised.
Mm-hmm.
Is there anything else that I need to know?
No.
No. Have you noticed any bruising?
I have not.
Any abnormal moles?
No.
Or new moles?
No.
And you said it itches, right?
Yeah.
Okay. Have you noticed any abnormal pigmentation?
It's red.
It's red. Has it gotten more red as the days have gone by?
It seems to be subsiding in redness with apple cider vinegar.
Alright, and it is a rash. Is it changing? Is it growing?
Mm-mm.
No. Alright, have you noticed any texture changes with your hair and nails?
I have not.
What about any growth changes?
No.
Have you had any hair loss?
Nope.
What about any other changes in your nails?
No.
Alrighty. Have you noticed any increases in your appetite?
No.
What about increases in your thirst?
No.
Changes in your urination?
Nope.
Have you experienced any hot or cold intolerances?
No.
And any other changes in your skin, hair, and nails that I should know about?
No.
Alright. What about feeling fatigued?
No.
Alright. Now I'm going to get your past medical history. Have you been diagnosed with anything?
No.
No. Have you been hospitalized?
I have not.
Have you ever had a surgery?
Yes, I had my tonsils removed when I was 5 and my wisdom teeth removed when I was about 17.
And where did you have these procedures done?
At Slutto Memorial Hospital in Slutto.
Louisiana?
Yes.
Alright. Are you up to date on your immunizations?
Yes.
Did you get a flu shot this season?
I did not.
Are you on any medication?
Nope.
Do you take anything over the counter?
Nope.
Anything herbal, vitamins, supplements?
Nope.
Are you allergic to anything?
Nope.
Alright, now I'm gonna get your family history. Are both your parents still alive?
Yes.
And how old are they?
My dad is 60, my mom is 58.
Do you have any kids?
I don't.
What about siblings?
I have 3.
Can you tell me about them?
My oldest sister Lauren is 28.
Okay.
My brother Jonathan is 26 and my sister Glenn is 23.
Alrighty. So in terms of the family that we just established, your mom, dad, and your 2 siblings, or your 3 siblings, as well as yourself, has anyone been diagnosed with high blood pressure?
No.
What about diabetes?
No.
High cholesterol?
Nope.
What about coronary artery disease, or excuse me, heart disease?
No.
Has anyone had a heart attack?
No.
Has anyone had a stroke?
Nope.
Has anyone been diagnosed with cancer?
My dad had prostate cancer.
Okay. Can you tell me anything else about that?
He's fully recovered.
Okay. Do you know what year that was?
No.
Alrighty, now I'm going to ask you some questions about your social history, and I just want to preface this with everything I ask you is just to know to be able to take care of you better. There's no judgment.
Okay.
Do you use any tobacco?
No.
No e-cigarettes or cigars?
Nope.
Do you drink alcohol?
Yes.
Can you tell me about that?
I drink alcohol about probably 5 times a week, just like equating to about like 5 glasses of wine a week
Okay.
at most.
Do you do any recreational drugs?
No.
Are you sexually active?
Yes.
Do you use protection?
Yes.
And have you been screened for sexually transmitted infections?
Yes.
Can you tell me a little bit about your diet?
I stay away from beef and pork.
Okay.
I eat plenty of vegetables and fruits and seafood.
That sounds like a well-balanced diet.
Thank you.
Do you monitor your salt intake?
Yeah, I rarely put salt on anything.
And do you exercise?
Yep.
Can you tell me about that?
It's about 5 times a week I'll exercise.
Awesome.
Calisthenics, jogging, stuff like that.
Good. That's awesome.
Thank you.
Are you currently employed?
Yeah.
Can you tell me about that?
I work at Trader Joe's.
Cool.
3
What do you
times
do
a
there?
week. Everything. I'm a cash register person, cashier, and I stock shelves.
Y'all all do everything?
Yeah.
Cool.
Yeah.
I love shopping there.
Cool.
Do you have insurance?
Yes.
Can you afford your medications when you get prescribed?
Yeah.
And what is your current living situation?
I live with my sister, Glenn.
Okay. Can you tell me about your skincare routine?
Yeah, I wash my face at least once a day, usually twice. And I use simple 1-ingredient things on my face, like Manuka honey and clay, castor oil, stuff like that.
Cool. And have you put any of that on the affected area for your rash?
No.
Alrighty, so what I'm hearing is that about a week ago you noticed a rash in the middle of your chest and it feels worse when you itch it. It's been pretty consistently present. You've tried to use some apple cider vinegar on it. About 2 times a day you'll put it on there and you think that's helping. Nothing's really making it better, nothing's really making it worse. It's not painful, it's not moving around on your body. Yeah, is there anything else you think I should know?
No, thanks. No.
Alrighty, Evans, thank you for talking with me.
Thank you.